Health is a human right, and every human being should be afforded access to healthcare.
What I'm passionate about in this is the unfairness that exists when some who need have least.
People around the world have very different opportunities. There are such profound disparities in the area of health that one sees a picture of a really divided world of the haves and the have-nots.
In Africa, we have 25% of the world's disease burden, with only 3% of the world's workforce today in health.
We need healthcare workers in each and every country.
There is a global health workforce crisis, which is characterized by widespread shortages, maldistribution, and poor working conditions.
Health worker migration represents the movement of health workers between and among countries.
The wealthier countries of the world are pulling nurses and doctors and other health workers from, in fact, some of the poorest nations in the world.
But, you know, one country can be a sending country and also a receiving country.
Within the countries as well, you know, from the rural areas to the urban areas.
Health workers migrate in search of a better life.
Theoretically, freedom of movement is a right of a person who has taken an education like medicine.
But then they leave behind a gap, they leave behind a need.
I also believe that society has got a right to say to that person, hey, look, you trained with our resources, can you be able to give something back?
In a sense, it's a loss of capital investment and it's a loss of skills. So you already have an imbalance and you aggravate the imbalance by causing this movement.
That imbalance, that chasm between workforce and disease is one that we can't sustain. We've got to find ways to address it more meaningfully.
Migration is not something to be prevented. Rather, it is something to be managed.
How best can we then manage the flow of that human capital? Just like diseases know no boundaries. Countries all over the world are interdependent.
Now the world is connected globally and calls like never before for coordination and collaboration.
This council came together between sending and receiving countries to talk about what was possible, to address these inequities and find more balance in the way that we manage our global health workforce.
This council has knowledge power.
This council will shine a light upon the problem.
We've been working together as a group over a number of years. We developed and negotiated a global code.
The Health Worker Migration Council had an incredible victory when 193 countries in the world unanimously passed the WHO Global Code of Practice.
A guide to countries on how they can ethically recruit health personnel.
And hopefully engage the countries of the world to take the problem seriously.
That's a very important step in the right direction because it sets a framework for the countries to address the issue of not only the shortages but also in terms of how they work with each other.
It is now incumbent on the Council to see that the code which they facilitated is implemented to scale.
To find ways in which we can then be able to move from policy to implementation.
To have the countries of the world accept this voluntary code.
It's a joint responsibility. So we have to come together, we have to work together, and we have to do it now.
Now you've got a more united voice across the world to deal with those problems.
The Holy Grail is better health for everyone. And to the extent that the health workforce improves the health of the people of the world, that will be the Holy Grail.